Hello students and my dear friends, myself Madhu. In this session, we'll discuss some of the immunohematology MCQs, that is blood banking hematology multiple choice questions, which will be helpful in the upcoming examination. First question, ABO blood group system discovered by option A, Sterling, option B, Karl Landsteiner, option C, Weiner, option D, Levine. Here, the right answer is option B, Karl Landsteiner. Here, ABO blood grouping, it was discovered by the scientist Karl Landsteiner. And if you see other scientist, that is Alexander Spener, he discovered the RH factor along with the Karl Landsteiner. And if you see Philip Levine, he was an immunohematologist. He has done advanced research knowledge regarding the RH factor, hemolytic disease of newborn, and blood transfusion. And if you see Sterling, he Van Dicaslow and Sterling, so they discovered like a type AB blood group. They are in association with the Landsteiner. So here the right answer is Karl Landsteiner. Next question, ABO blood group system was discovered in option A 1904, option B 1991, option C 1901, option D 1902. Here the right answer is 1901. So ABO blood group system, it was discovered in the year 1901. Next question, antibody of ABO system. Option A, IgG, option B, IgE, option C, IgM, option D, IgA. Here the right answer is option C, IgM. So antibody for ABO system is IgM. So IgM is the predominant immunoglobulin for A and B antibodies. Next question, most compatible cross-matching among the following is option A, donor group is A and patient group is AB. Option B, donor group is AB and patient group is A. Option C, donor group is A and donor group is B. Option D, donor group is O and patient group is AB. Here, the right answer is option D, that is donor group O and patient group OB. So here, as you know, universal donor is O negative and AB is the universal recipient. So here that is a most compatible cross match. Next question, IgM is A. Option A, pentamer with 10 antigen binding sites. Option B, tetramer with 8 antigen binding sites. Option C, monomer with 2 antigen binding sites. And option D, dimer with 4 antigen binding sites. So if you see the IgM, the right answer is IgM is a pentamer. So pentamer means which is made up of 5 monomeric units. So these 5 monomeric units, they are held together by the J chain, that is called as the joining chain. They have 10 antigen binding site. For each monomer, it has 2 attachment sites. So that's what pentamer has, 10 antigen binding sites. Next question, most of the blood group antibodies react at best pH. Option A, 6.5 to 7.5. Option B, 6 to 7. Option C, 7 to 8. Option D, 5 to 6. Here, the right answer is option A, 6.5 to 7.5. So most of the blood groups, most of the blood group antibodies, they react at a best pH of 6.5 to 7.5. Next question, the optimum time, that is optimum incubation time for all blood group reaction is option A, 60 minutes, option B, 50 minutes, option C, 30 minutes, option D, 15 minutes. So here the right answer is 60 minutes. So what is the optimum incubation time? What is minimum time we have to wait for reaction? that is 60 minutes. So minimum 60 minutes is considered. That is optimum incubation time. Next question. Common enzymes used in blood bank serology is option A, papain, option B, trypsin, option C, fisin, option D, bromelain, option E, all of the above. So here the right answer is option E, all of the above. So enzyme treatment is useful for differentiation of multiple antibodies and for enhancement of detection of weak antibodies and adsorption methods. So all these enzymes are used in the blood bank serology. Next question. The two blood tests include option A, RH and ABB, option B, ABO and RH, option C, ABC and RH, option D, ABD and RH. Here the right answer is option B, ABO and RH. So what are the two blood tests we do? That is ABO and RH. And ABO group, like it is ABO test. It is to know the blood type. And RH typing is like to know RH typing is done to know whether it is positive group or negative antigen. Next question. Other than transfusion, when it is necessary to take RH factor into consideration. So when we should consider RH factor other than the transfusion. Option A, catheterization. Option B, pregnancy. Option C, spleen rupture. Option D, blood donation. Here, the right answer is option B, pregnancy. So in the pregnancy, it is necessary to know the RH factor. So what is RH factor? It is a protein which is present on the RBCs. So here, it is used to indicate whether the blood of two different people is compatible when it is mixed, such as in case of mother's blood and her baby at the time of birth. So this is routine and important that to know the RH factor of mother and unborn child to be determined during the pregnancy. Suppose if the mother is RH negative and if the baby is RH negative, so there is no usually any concern, so nothing will happen. But if the mother is RH negative and if the baby is expected to be RH positive, then mother blood produce anti-D antibodies. What these anti-D antibodies they do? They show the effect on the development of unborn child. So that's what during the pregnancy. So we should consider the RH factor. Next question. How long can blood store after adding additive solutions? Option A, 42 days. Option B, 28 days. Option C, 55 days. Option D, 12 days. Here the right answer is option A, 42 days. So here after adding the additive solutions, we can store the blood for from almost 35 to 42 days. So additive solutions, what are the additive solutions? They replace the nutrients which are lost when the plasma is removed from the red blood cells. So when the plasma is removed from the red blood cells, some of the nutrients are lost. So these nutrients are replaced by the additive solutions. So when we add this additive solutions, automatically the storage time is increased from 35 days to 42 days. So what are the two solutions we add? Adisol and Optisol. So what are these Adisol and Optisol? They consist of adenine, glucose, saline, and mannitol. Next question. The storage temperature for blood is option A, 0 to 2 degrees centigrade. Option B, 2 to 6 degrees centigrade. Option C, 2 to 5 degrees centigrade. Option D, 2 to 4 degrees centigrade. Here, the right answer is option B, it is 2 to 6 degrees centigrade. So red blood cells and whole blood, they should be always stored in between of 2 to 6 degrees centigrade in a blood bank refrigerator. The right answer is option B, 2 to 6 degrees centigrade. Next question. What are the common risks of donating blood? So what are the risks associated with the donating of the blood? Option A, contrast common viruses. Option B, bacterial infections. Option C, low blood pressure. Option D, none of the above. Here, the right answer is none of the above. Here, by the donation of the blood, nothing will happen to the donor. So there is no risk for the donor. But after donating the blood, the donor will experience weakness, dizziness, feeling faint or lightheadedness, nausea, bleeding from the needle prick site, or pain at the needle prick site. So that is very common things. So they need not to worry about all these things. They disappears within the 24 hours. But all these doesn't take place because of this donation of the blood. Next question. The transport temperature for RBC rejuvenated. Option A, 2 to 6 degrees centigrade. Option B, 1 to 10 degrees centigrade. Option C, 3 to 4 degrees centigrade. Option D, 0 to 2 degrees centigrade. So here the right answer is option B, 1 to 10 degrees centigrade. So here for transportation of RBC, we should maintain the temperature under 10 degrees centigrade. That is in between 1 to 10 degrees centigrade. So from blood bank to the site, we can place them in the blood transport box or insulator carrier, so which is stored in between 1 to 10 degrees centigrade. But for storage of blood, generally we maintain the 2 to 6 degrees centigrade. But for transportation, 1 to 10 degrees centigrade. Next question. The expiration date of platelet pooled cells. Option A, 2 hours. Option B, 4 hours. Option C, 1 hour. Option D, 5 hours. Here the right answer is option B, 4 hours. So pooled platelets, they expire within 4 hours from the time of preparation. So what are the pooled platelets? So pooled platelets, they are the blood component products. So these pooled platelets are derived from the whole blood donations of 4 to 6 donors. From 4 to 6 these donations, we prepare this pooled platelets. So there are two methods for extracting individual platelet concentration. So one is platelet rich plasma, that is PRP, and another is the Buffy coat, BC. So here the right answer is option B, 4 hours. Next question. Period of deferral of tattoo. Deferral means they are not eligible for the tattoo. So if the donor has the tattoo, so how long, if any person is having the tattoo, how long they are not eligible for donation of the blood. So here option A, 6 months. Option B, 12 months. Option C, 3 months. Option D, 4 months. Here the right answer is 6 months. So if you have the tattoo, you are not eligible to donate the blood for up to 6 months. So why you are not eligible for donation of the blood? So this is because precaution against the cross contamination of blood-borne diseases like hepatitis, HIV. Okay, so to avoid all these things, minimum 6 months of deferral is done. Which of the following is a condition for rejection of blood? Option A, cancer. Option B, hepatitis B infection. Option C, heart disease. Option D, all of the above. So here the right answer is all of the above. So in case of cancer or in case of hepatitis B infections or heart diseases, we are not supposed to collect the blood from the donor. Next question. The person who donate their blood in replacement of the blood needs of particular patients is called. So here the question is the person who donate their blood in replacement of the blood needs of particular patients is called. Option A, replacement or relative donor. Option B, directed donor. Option C, commercial paid donor. Option D, autologous donor. Here the right answer is replacement or relative donor. So what is mean by replacement or relative donor? Replacement or relative donor is one who gives blood when it is required by the members of his or her family or community. So just they give the blood in the replacement. So they are called as replacement or relative donor. So what is mean by directed donor? So directed donor is someone, generally they are like a parent or family members or friend who donates blood specifically for a patient in advanced schedule for a procedure or for transfusion. So in advance only, like their family members or friends, they donate the like blood. And a commercial paid donor. So commercial paid donor. So as you know, they take the like money or just they'll take the like other benefits or any other like form of the like rewards. So they will take in return of the blood. So they will give the blood. For that blood, they will take either money or some gifts. Next, autologous donor. So what is mean by autologous donor? So autologous donor, the blood it is collected from the patients who may need blood for their own. So like for themselves only, like they donate the like blood. So that will be used during or after surgical procedures. Next question. When did a person can donate blood after recovered from the chickenpox? Option A, 4 weeks. Option B, 8 weeks. Option C, 12 weeks. Option D, 6 weeks. Here, the right answer is 8 weeks. So after chickenpox, like once the person is recovered from the like chickenpox, after 8 weeks only they can donate the like blood. But according to some literatures, so minimum 4 weeks is required. So after 4 weeks only, like they can donate the like blood. So next question, how long does it take your body to replace the blood loss during the donation? Option A, 2 days. Option B, 2 weeks. Option C, 2 months. Option D, 2 years. So the right answer is option C, 2 months. So generally the blood volume is replaced within the 24 hours only. But red blood cells take between like 4 to 6 weeks to like completely replace it. So like to replace like a complete RBC, it will take almost like 4 to 6 weeks. That means 1 to 1.5 months. So that's what like a minimum 8 weeks. Like we have to wait in between the like 2 donations. So to replace the like a complete blood, it will take almost 2 months. So that's what minimum 2 months is like required in between the 2 donations. Next question, the deferral period after rabies vaccination to donate blood is option A, 2 years, option B, 6 months, option C, 1 year, option D, 3 months. Here the right answer is 1 year. That is option C, 1 year. So if we give this vaccine as a post-exposure prophylaxis. So what is meant by post-exposure prophylaxis? So in case of dog bite happens, okay, in that cases, if we give this vaccine, so minimum 1 year, like they are not supposed to give the like blood. But in case of non-exposed person, so means those who are taken the vaccine under pre-exposure prophylaxis. Pre-exposure prophylaxis means before the like a dog bite. So either laboratory workers or the persons who are at the risk of developing the rabies, they will go for pre-exposure prophylaxis. So for this pre-exposure prophylaxis, it is accepted, but minimum 2 weeks is also they are not supposed to donate the blood in case of pre-exposure prophylaxis. In case of post-exposure prophylaxis, so minimum 1 year, that is 12 months, that is a deferral period. Next question, FNHTR is prevented by option A, transfusion of red call concentrate. Option B, transfusion of platelet-rich plasma. Option C, transfusion of leukodepleted red cell concentrate. Option D, transfusion of granulocyte concentrate. Here the right answer is transfusion of leukodepleted red cell concentrate. So what is meant by FNHTR? That is febrile non-hemolytic transfusion. Febrile non-hemolytic transfusion reaction. So this is the most common type of transfusion reactions. So why this transfusion reaction takes place? Because cytokines, okay, cytokines, they accumulate during the transport of during the storage of cellular components. So when we store the blood, so in that cytokines are accumulated. So that is the most common cause of FNHTR, that is febrile non-hemolytic transfusion reaction. So if the patient is known with the 2 or more documented FNHTR, they should receive only leukocyte depleted red cell components. Next question, non-cardiogenic pulmonary edema is due to the presence of option A, histamine, option B, IgA antibodies, option C, leukocyte agglutinin antibodies, option D, none of these. Here the right answer is option C, leukocyte agglutinin antibodies. So leukocyte agglutinin antibodies. So they are because of the TRALI. What is TRALI? Transfusion related acute lung injury. It is because of the transfusion. Next question, the transfusion reaction with fever, maculopapular rash, watery diarrhea, abnormal liver function, and pancytopenia. Option A, transfusion associated sepsis. Option B, TRALI. Option C, transfusion associated GVHD. Option D, transfusion associated allergic reactions. Here the right answer is transfusion associated GVHD. So what is meant by transfusion associated GVHD? Transfusion associated GVHD means that is transfusion associated graft versus host disease. GVHD means graft versus host disease. So it is the rare and usually fatal complication of blood transfusion. So in which lymphocytes transferred from the transferred blood component, they attack the recipient tissues. So the lymphocytes of the transfused blood, they attack the recipient tissues, especially they attack the skin, bone marrow, and GAT. Next question, normal level of haptoglobin in plasma. So what is meant by haptoglobin? Haptoglobin, it is a protein which is made by the liver. So what is the function of this haptoglobin? So it makes to get rid of hemoglobin outside of the RBC. So generally hemoglobin, it is present inside of the RBC. So the free hemoglobin, it is eliminated because of this haptoglobin. So it is crucial for elimination of free hemoglobin. So what is the normal value here? Option A, 1.0 grams per liter. Option B, 2.0 G per hour. Option C, 0.2 grams per liter. And option D, 0.1 grams per liter. Here, the right answer is option A, 1.0 grams per liter. But the reference range is in between 0.5 to 2.2 grams per liter or 50 to 220 mg per dl. So what is the reference range? 0.5 to 2.2 grams per liter or 50 to 220 mg per dl. But in these options, the right answer is option A, that is 1.0 grams per liter. Next question, color of amniotic fluid in HDN. What is HDN? Hemolytic disease of the newborn. Option A, red. Option B, brown. Option C, dark brown. Option D, yellow. So here the right answer is yellow. So in case of hemolytic disease of the newborn, the amniotic fluid color will be in the yellow. So generally normal amniotic fluid is clear or tinted yellow. So in this case of amniotic fluid, so it will become the thick yellow or dark yellow. Next question. Amniocentesis is done in between which weeks of the pregnancy? Option A, 15th to 20th week of. Option B, 2 weeks. Option C, 32 weeks of gestation. Option D, all of these. Here the right answer is 15th to 20th weeks. So what is amniocentesis? Amniocentesis is done during the pregnancy. So what is the purpose of this amniocentesis? To check whether the baby has any genetic or chromosomal abnormalities. So which may cause like a Down's syndrome or Edwards syndrome. So in the amniocentesis, what we do? So we remove and test a small sample of the cells from the amniotic fluid. So this, what is amniotic fluid? That is a fluid which surrounds the baby in the womb. So in case of amniocentesis, that is done in between 15th to 20th week of the pregnancy, and even after that also we can do it. It can be performed even earlier also, before 15th week also. We can do this amniocentesis, but there are risk of complications. There are chances of complications. What are the complications? Cramping, bleeding, or leaking of amniotic fluid, or sometimes it leads to injury or infection. Next question. HBV is transmitted most frequently. What is HBV? Hepatitis B virus. It is transmitted most frequently. Option A, by needle sharing among intravenous drug abusers. Option B, through blood transfusion. Option C, by unknown method. Option D, by sexual activity. Here, the right answer is by sexual activity. So here it is also transmitted by needle sharing as well as blood transfusion. So, but it is mostly transmitted by the sexual activity. Here the right answer is sexual activity. Next question. The first retrovirus to be associated with human disease was option A, HCV, option B, HTLV1, option C, HIV, option D, NNV. So what is HCV? That is hepatitis C virus. What is HTLV1? That is human T lymphotropic virus 1. Option C, HIV, that is human immunodeficiency virus. What is NNV? NNV means nervous necrosis virus. So that is also called as beta noda virus. Here the right answer is HTLV1, that is human T lymphotropic virus 1. So it causes adult T cell leukemia or lymphoma, that is ATL. So it is a oncogenic human retrovirus. It is transmitted through infected body fluids, including blood, breast milk, and semen. And if you see the new one, NNV, that is nervous necrosis virus, or it is also called as beta noda virus. So it causes viral nervous necrosis. So what are the signs of viral nervous necrosis? Abnormal behavior like lethargy, spiral swimming, and change in the pigmentation. Next question. Nucleic acid amplification testing for HIV was instituted in donor testing protocols to option A, identify donor with late stage HIV who lacks antibody. Option B, confirm the presence of anti-HIV in asymptomatic HIV infected donor. Option C, reduce window period by detecting the virus earlier than that of available test. Option D, detect antibodies to specific HIV viral proteins. Here the right answer is to reduce window period by detecting the virus earlier than other available tests. Thank you.